Welcome, everyone, to this short podcast talk on de-risking healthcare communications. So an efficient NHS, and therefore a system with increased patient safety, is reliant on effective communication, whether that's within the organisation itself, amongst its staff, with fellow healthcare stakeholders, or directly engaging with patients. So I'm Mark Blanchard, I'm the Public Sector Director for GovNews, and I'm delighted to be joined by two expert guests to talk about this very important subject. From Bytes, I've got Justin Powell, who is the Microsoft Unified Communication Specialist. Justin, great to have you with us.
Afternoon, Mark. Thank you for having me.
So, as a highly experienced sales specialist, I'm told, with expertise in unified communications, contact center, and collaboration within and with Microsoft Teams and RingCentral, Justin has worked in the vendor space as well as distribution and has joined Bytes Software Services, where he has a track record of delivering innovative UC and contact center and collaboration customer projects across, well, enterprise, public sector, and the NHS, which is what we're here to discuss today. So, Justin, great to have you with us. Joining Justin, we have Chris Bayliss, Head of New Business in the UK at RingCentral. Chris, welcome.
Thank you, Mark. Great to be here.
So 15 years experience in helping the NHS transform their approach to clinical communication and collaboration. Chris has helped many of the largest NHS trusts transform the way that them as an organisation, indeed their clinicians, communicate and rethink how patients access services using digital technology. So those are my two panellists. Great to have you both with us. So I'm going to start straight away. Chris, I'm going to come to you if that's okay. The NHS Cloud Centre for Excellence is championing cloud adoption across the NHS. What are the most compelling benefits of a cloud-based communication and collaboration platform and system in healthcare?
No, thanks, Mark. Wow, how long have we got? There are so many great benefits of moving to the cloud for the NHS. I've broken down really into three key areas. So, connecting to patients quickly, safely, and with ease, improving patient satisfaction, and then also improving care coordination. So, in terms of the first one, what's absolutely key and a bedrock of any kind of cloud communications or any communications platform is to ensure that a call is never dropped. At RingCentral, we really pride ourselves on our contractual 5 nines SLA for call for availability, platform availability. In reality, we've achieved 6 nines for the past 4 years. Well, that means is if a patient needs to call into the trust, you'll never drop a call, never lose that important patient call. And because we invest multi-millions of pounds into in R&D into our platform, we can deliver that SLA to the NHS. It's important to easily allow friends, family, clinicians to connect to patients as well. And also, one thing that we see as well in terms of NHS trusts, whether they're in the community or in acute hospital space, expanding into new sites is really important. With the cloud, all you need to do is have an internet connection and you're away. No kind of carting expensive, complex equipment around different sites. You can support modern ways of working straight away. In terms of improving patient satisfaction, this is absolutely key. And the best way to improve patient satisfaction is to obtain and use management information on performance to make informed decisions, data-driven decisions on patient care. And again, that's the beauty of the cloud. Every interaction from a patient, from another partner organisation, is all being collected and stored in the cloud platform. So you've got that single platform for telephony, back office, and patient contact. You can deliver a load of kind of really useful data-driven insights from that.
Okay.
Also, in terms of driving patient satisfaction, providing patients with a choice of how they contact the trust. So through a cloud platform, you can begin to move away from just the voice-only contact to maybe offering digital channels like WhatsApp, web chat, other social media channels that I'm probably too old to understand. Provide patients with the means to access the services through that way. And then finally, kind of improving care coordination. And what I mean by that is really removing geographical and digital boundaries between trust locations, and also delivering care to the home. So, as I mentioned, cloud platform can be accessed from anywhere on any device with an internet connection. You can deliver better healthcare and improved coordination with that kind of single platform.
Okay, so that's quite a lot of compelling benefits. So, according to our research, 34% of health and care organizations have already migrated their telephony to the cloud, which actually is lower than the public sector average. With all those benefits, what do you feel are the main barriers that have prevented the NHS from transitioning to the cloud when it comes to telephony? And I suppose from your perspective, Chris, how can those barriers be overcome?
Yeah, sure. No, it's another great question, Mark. From my perspective, I think the first point is some organisations or individuals that are surveyed may not have distinguished between a hosted platform, which is basically a premise-based solution, but in someone else's data centre, with a true pure cloud platform. So a hosted platform still comes with some of the same disadvantages as an on-premise platform. So regular hardware refreshes, tied to desk phones, not really flexible in delivering agile working, whereas a pure play cloud platform comes with the benefits that I've just discussed. So I think it's worth all organisations understanding those key differences. In terms of more broadly, I think a lot of organisations maybe have perceived in the past the change to be quite daunting from a business change perspective. I think there has been in the past this perception that cloud equals less reliable and less robust, when actually it means the opposite. And I think I mentioned in the first answer, an individual NHS trust can only invest so much due to resource constraints in their own communications platform. We invest like hundreds of millions in ours and drive those economies of scale of that investment to our individual customers, i.e. NHS trusts. So we're able to scale that reliability like really quickly and deliver that to our end customers.
Okay. Justin, I'm going to come to you. Why should NHS organisations now make that strategic switch to the cloud, to cloud unified communications? And perhaps if you want to share some examples from other Bytes customers that you've been working with and what their compelling reasons were, and potentially, I suppose, inform our listeners of any lessons that they've learned along the way.
Thanks, Mark. I think one of the key things I've seen over the last 6 to 12 months is most NHS trusts have either still on-prem or actually they moved to the cloud very early, but the cloud solution isn't doing what they want it to do today. I think the pandemic has made a huge difference to how even the NHS work and see a telephony platform today as it was pre-pandemic, where a lot of trusts are hybrid workforces today. They are as hybrid as enterprise. They're not all going in, they're working from different locations. And also one of the key factors that we see every time is Microsoft Teams has changed the landscape of how trusts and NHS work around what does that platform do, and more importantly, how could it start bringing telephony together. And most trusts have got on-prem, and one of the key challenges for any trust is how do we join up the Teams and enterprise space to not just for like patient care, but for internal communications and collaboration and working smarter and more efficiently. So like when we're talking to trusts that are on-prem, one of the key things that where we see a massive partnership with RingCentral is all around the Teams platform and what that delivers to what we call a basic collaboration user in the trust. But it's when they want to take it to the next level and really start looking at communication as a service. And that's around internal, communication as well as patient care and external comms channels. And the patient of today is completely different to the patient of 10 years ago. We were used to going into locations, we would ring up, we would do anything. The patient of today wants different channels to communicate. And a lot of the times what I see is that trusts now are starting to understand that telephony and collaboration is a major investment that they need to make to improve so many services. So that's where we start talking to them around how we can move. And I think it's really important, what Chris said, is most IT departments really are just looking at a platform. What they want to do is how they can improve a number of things for the trust. Is internal comms and external, but one of the key drivers that we face on everything is saving money, and how solutions today can make a real impact into cost savings and not actually growing costs, where the trust of today wants to make those savings, and actually how comms can make a massive saving and more benefits to them. So that's like the challenges I see on most calls, is those key things. One, how do I look at bringing collaboration technologies together? Because there's major investments across the trust, and what's the best way of doing it? How do we enable what we call standard devices, the analog device, the deck phone, which is absolutely key in the NHS, to work and still work, because they're the critical lines that can't go down? And how do we improve that patient care? What technologies can we offer the trust to make it easier, more simple for those patients to call in, IM, text, web chat, whatever? But those social media channels are becoming more prevalent. And in a way, bringing them into the 21st century is what I see more than anything. And that's what they're looking for, is how we can achieve.
Okay. So, Chris, from your perspective, if an NHS organisation's unhappy with their communication technology, or maybe not necessarily unhappy, but want to now start, achieving some of these benefits we've just been talking about, how difficult is it for them to actually separate from their incumbent solution to something more innovative for them in the NHS? And is there any advice that you can offer in, migrating and maybe future considerations around integration?
Yeah, thanks, Mark. So RingCentral, we've got great technology. Some of the stuff that I've described already. And we'll talk, more into the more innovative areas of like AI later. But probably the most important thing is this question around migration and what we like to call safe transition. We recognise NHS are offering, mission critical services to patients, services that are the difference between life and death, and that can sometimes mean, there's definitely a nervousness, and rightly so, around migrating any technology in the NHS. I think the first piece of advice is, partner with organisations that live and breathe the sector, like Bytes and RingCentral, that have referenceability and that have done this before. Mm-hmm. I think that's absolutely key, and can bring experiences of not only the good experiences, but maybe learn from some of the mistakes and teething problems of the projects, and bring that learning into your projects. I think the other piece of advice I would say is, depending on the size of the organisation, we can kind of go at your pace. So we've done projects like we're doing one with a mental health community trust, where we're doing a kind of a big bang approach of moving 3,000 back office users and 40 contact center agents onto our platform in 3 months. Or we can do we could do a migration in stages. So I think the first thing I would say is, don't look at it as you have to do everything in one go. We can, if the situation needs, but you can also look at doing things in stages. And that's again, going back to your first question, the beauty of the cloud. We integrate into other platforms, so we can take a migration department by department, integrate into the existing platform, test it to death so that it's robust and it's delivering what you want, and then switch off the existing platform as soon as all that testing is done. So that's the other key thing. The cloud, you can kind of build our platform in parallel to the existing one and really kind of de-risk that piece. And then what that also allows you to do is, and let's face, the NHS has got some legacy systems that and integrations. We can then also build that into the plan as well, and do it at the right pace. And I'm going to expand on that question and answer that question a bit, Mark, as well, because it's not just around the initial project. When you're investing in a cloud solution, you're actually removing the need to do future projects, because the platform, we're updating the platform, adding new features and functionality as technology evolves, and that's included in the licensing, because it's as a service. So you're actually removing that kind of, in 5 years' time, oh no, we need to do all this all over again. We need to disrupt our patients, our staff. Once you've done it once, you can then iterate over time. So I think those are the areas of advice I'd give on this.
Can I add some value in there as well, Mark? I think one of the key things that I put forward as well is that it has to be more than an IT project to actually deliver a solution that's going to work and actually give massive return on investment. And one of the things I talk to our clients about is persona engagement right at early doors, where you've got to bring key stakeholders in from the trust and not just IT. What you've got to be bringing is people that are actually using and working the telephony platform. Because if you get their buying and their understanding, one, what we see a lot of is they don't really know what's in the market today. They know what they know. And when you start bringing them in and you show them the art of the possible, I think they understand how much technology can really improve their jobs and really improve how they work. And once you start doing that, you get more. And I think the benefit of trust is that there's always going to be a cost element to anything in life, but it's about the human factor is how much can it improve people, not just internally, but externally, and make lives easier. And communication and all of that does that in a heartbeat. And I think one of the things I always say is get the receptionists involved, get other stakers involved, because they're the ones that understand the daily challenges of what you're doing. And then once you get round that, and also as well, when you go to tender, I think one of the key things is you're then writing a tender that really works for the trust and what people need in the trust, and not just from an IT perspective, which sometimes is quite data driven, where it's actually a personable thing. So that's a bit of advice I would give to any trust is if you're looking at this project and you're doing research, bring other people into the research to see how they want the system to work.
Mm. Do you see that a lot when you're looking and reviewing those tenders as to whether they're actually set up to fail based on what they're including in them and the considerations that they've not put in there?
100%, and Justin, it's a great point. Yes, so a lot, some tenders are technology driven and not patient or people driven, and those are the projects that typically run into issues. I think we learn from our conversations with these trusts as well. And a project Justin and I were recently involved in. We were talking about omni-channel contact center. We had ideas of how that could be implemented, but one of the patient contact center managers saw WhatsApp, brilliant idea. If we could route WhatsApp's messages into the contact center, we've got service users that in the mental health space that don't always want to pick up the phone. They definitely don't want to turn up. But this could plug a gap. It's easier for them to send a WhatsApp, more anonymous, and we can deliver better patient care to more people that way. And it also kind of ticks some of the boxes around efficiency, and so it ticks so many boxes. And Justin and I learned around that use case from having these conversations. So you can't do that. It's difficult to do that within the confines of a tender as well.
Yeah.
And I think every trust is different. I think one thing that I've learned is that it's not like, one fits all. It definitely doesn't. Each trust has its own drivers, its own demands. And more importantly, there's trusts, that have jumped early into the cloud, but realize now that, it just doesn't do what it wants to do. And there's been early adopters, and there's a trust we're working with at the moment that's still on-prem and, doing a lot of what I call old school telephony. So every trust we see, I think, has different challenges. I think the key thing that we want to get them to understand is that what's the right technology for them. And more importantly, do they need 5 bits of technology that 1 bit of technology can do? Because I think this is another thing also, is that a lot of trusts I speak to have different solutions and they're trying to bring them all together, where, what we're trying to get them to do is, well, if that can be done under 1 solution or 2 max, it's going to be a much easier way of managing your comm strategy moving forward.
Okay, so how will the shift from analog and on-prem to cloud-based communication tools help to address some of these current challenges that the NHS is facing right now, Chris?
Yeah, sure. Thanks, Mark. So, analog technology. What it's typically done is kind of tie users down to a location. So, typical the old world is having an on-premise PBX in a room somewhere, in a hospital trust, in a community site, and there'll be, let's face it, lots of telephone handsets connected to that in various spaces within the trust. Now, some of those handsets will always need to be there, right? Some of those in shared areas, on wards, like the double two kind of crash call phones. We could probably argue that as well, but that's probably a whole nother whole nother podcast. But equally, there are a lot of handsets that are sat in rooms that no one's in because they're delivering healthcare out in the community. So there's mobility in the community. There's mobility within a hospital campus. So moving away from that to the cloud enables that full flexibility, that full mobility. So clinicians can have access to communications wherever they are, whether they're running up and down wards, whether they're out in the community delivering healthcare, and they can really, collaborate with each other, talk about patients, but also talk with patients from anywhere. So I think that's really important. 2025 is soon coming round. Like I think you said in the introduction, Mark, I've been doing this a long time. I know I don't look that old, but yeah, it has been 15. It has been 15 years, and I'm actually kind of surprised and somewhat worried with the amount of organisations that we speak to that aren't kind of ready for that transition. So it's definitely still the right time to talk to the industry around how you look to migrate away from that technology. The good news as well, and I'm going to link this back into a previous question as well, is I think we've mentioned like Microsoft Teams as well. So Microsoft Teams, I think there's 1.5 million licenses in the NHS. Teams has driven a lot of that migration to the cloud, a lot of that kind of shift of thinking from handsets being locked to desks to going out communicating and collaborating from anywhere. The great thing, the next step for that though is integrating that with telephony contact center services, but doing it in a safe way, like with a platform that has got five nines availability that does offer that omni-channel capability as well. So taking the user adoption, the familiarity of Teams, embedding a full enterprise grade reliable communication system into that platform, that's a really great way to deliver those benefits.
Okay. So Justin, the NHS, like Chris said, invested significantly in Microsoft. Does that alone not provide reliability, functionality, and that desired unified communications as a service solution which the NHS requires moving forward?
I think right now, no. It's made massive steps as a telephony platform. I think one of the key things that Microsoft deals very well is the collaboration on what I call basic telephony requirements across the trust. But I mean, one thing that we always talk about is reliability and resiliency, and where that sits in a trust, and how important certain trusts I deal with have gone down the Microsoft path and are fully fledged into that. I think one of the key things around the Microsoft Teams ecosystem is everything is doable in Microsoft Teams. It's just not in Teams. So what Microsoft have really pinned their strategy on is working with third-party vendors, and you can include RingCentral as one of those, because ultimately they know that Ring, can deliver aspects of a telephony platform that Teams can't do. I mean, that's why it's an open platform for providers like RingCentral to come in and really add value. So as a trust, what we say to them is there's pretty much two ways you can go as a trust. You can be fully in Teams and then start looking at an ecosystem for analytics, call recording, receptionists, contact center, because they're all available in the Teams ecosystem. It's just not Teams. But you can fully run that, as a Microsoft Teams platform. Or do you want to look at an enterprise platform like RingCentral that delivers all of those elements in a single license cost, but also sits into the Teams environment? And I think what Teams has done for people is people now look at a desk phone and go, I do not need this piece of kit anymore because I'm just used to actually using Microsoft Teams, right? So one of the key elements in trust and NHS that we come across is that they want to get rid of a high percentage of handsets. As Chris highlighted, it's never going to be 100% because you can't in an NHS trust. But one of the things that you look at is about adoption of the mobile phone, right? And mobiles have come a long way. So it's also utilizing technology where which members of my team can I utilize for a mobile where I don't need a desk phone? I might not even be a laptop soft phone user. So what Teams or RingCentral is delivering is all of that unified communication benefits, but to a mobile device or to a deck phone that has other utilizations like scanning documents or being a barcode reader. Because The other thing driving NHS is what technologies can we unite to make it much easier? If you look at like an NHS person, they can have 3 devices, right?
Yeah.
They've got to,
Yeah.
how do we bring that down to 1? So you look at the mobile device as that single point. Well, there's technologies now that sit on that mobile that enable that person to do so many different things. You remember, the different types of users might be an iPad user or an Android tablet user that's got to look at x-rays or patient documents. How do I bring the world of communications into that person? Well, with a soft phone application, it's much easier because it sits on there and you're making it more beneficial. So long-winded answer, but that's how I see it, as one of the key things that teams will eventually start getting there. But right now, I don't think it's ready as an enterprise voice system in its own right. But as an ecosystem, it will give you what you want with its partners that sit there.
I mean, Mark, just to take, just to add a couple of extra examples. If you think about Microsoft Teams, in terms of video, it doesn't integrate fully into Zoom, so you can't mix the Teams and Zoom video. Doesn't integrate with Slack from a messaging point of view because they've got that down, but does offer integrations into the likes of RingCentral because I think they recognise, to Justin's point, that there's a capability gap. And Teams is great. It's really, like I say, it's driven the industry forward, further than it should be, right? Further than it naturally would be otherwise. But yeah, absolutely, that platform approach, that dual cloud approach as well, where if Teams goes down, you've got another platform that's available for mission critical, services like voice. I think is really key to NHS customers, especially where like that, like I said at the start, connecting a call, or not connecting the call can be quite serious. So I think that's where we see our integration with Teams like being really, really beneficial in this space.
Okay.
And most users just want it in that platform. I think one of the key changes that RingCentral has brought to the market in the last 6 months is their version 2 of Teams integration. It's been a game changer where there's so many now advantages of this fully integration into Teams, dual presence, so much more real good telephony that sits. Because ultimately the key driver for any customer is, all they wanted it was to sit what I call in the purple pane of glass. That's the desire for most customers. And where Ring have really driven that is that now as a mobile user or a soft phone user, everything is in that purple pane of glass, but I'm just using Ring. I'm using a Ring icon instead of a purple handset, and it's given me so much more benefits. But that's huge advancements I've seen. That's really, for me, the game changer, where trusts are looking at that utilization of Teams. They made a huge investment in Microsoft, and that's not going to go away. What can they do to add value?
Okay. I'm conscious of time, so I'm gonna put one final question out there. Chris, I'm going to come to you. We talk about the art of the possible. So when it comes to digital communication acceleration in healthcare settings, are we going to see more NHS communication bots? Are organisations going to feel comfortable when it comes to AI in their communications? Are we going to see AI healthcare assistants engaging with patients? What's the art of the possible when it comes to Ring? You must have quite a lot of knowledge in that R&D department. What are you working on?
Yeah, Mark, look, it wouldn't be a technology podcast without talking about AI, for sure. So, like for me, there are three flavors of AI that we're working on, and let's face it, the industry are working on that could benefit the NHS. It's like generative AI is the big talking point at the moment, like to chat GPT. So learning patterns and generating content. Conversational AI, which is around chatbots and virtual assistants, and then conversational intelligence as well around monitoring and analyzing conversations. So I think bots and AI in healthcare assistants are important, but I think it goes beyond that. And if you think about generative AI, the ability to optimize resource allocation, potentially predict patient outcomes, automate routine tasks. You could enhance areas like medical imaging analysis. You could support drug discovery, facilitate personalized treatment plans. All of that has the ability to improve efficiency in patient care. In terms of conversational AI, so the chatbots and the virtual assistants, which I think is more, if you ask most people in the street around what AI means, then it probably means something like that. Again, you can streamline communication, provide instant responses to common queries, schedule appointments and offer other health-related information. And I think what's really key with this is it's not replacing voice. And I'm not just saying that because I'm from RingCentral and our kind of heritage is in voice, and that we are 100% moving into an AI first organization. But if you take some of the those queries that are absolutely clogging up your switchboard, when's my next appointment, when's my prescription due, except when are my results due, and you move that to a kind of AI automated service. So you deliver the people with the digital acumen and the technology to be able to obtain that information. You're going to free up the phone lines for the people, the most vulnerable people that really need to speak to someone over the phone. So it's around freeing up those phone lines, which is your highest value channel, to speak to those patients that really need it, and then kind of pushing not pushing is the wrong word, pulling, I like to say, the people that have digital means and want instant answers to a digital channel, which can be supported by AI. And then finally, I think the other area, again, we focus a lot on the front-facing AI, so generative AI, conversational AI, but there's also how do you support your staff in the background with conversational intelligence. So again, we've got technology that again can monitor and analyze conversations. So you could provide a call handler with instant feedback on the sentiment of a call, or identify maybe an urgent case through analytics. Point out to a supervisor that maybe a call handler didn't say an important piece of essential information at the start of a call or the end of the call. So there's the ability to really support the call handler or the agent with information through AI as well. So those are the three areas, Mark, that I think are really important in this space for health.
Just bringing in documentation, I think AI just drives in a different way of, if I'm talking to a patient, what documents do I need to bring up to help that advisor there and then, right? It's a self-learning tool. All of these things start making calls quicker. ChatGPT, for example, can, help you round up the call quick. You don't need to go on not ready, because it's going to actually take the call, wrap it up nice and quickly and effectively, drop it into, because the other key thing is API integration as well. That's a key thing that doesn't get talked a lot, but the platforms in the NHS want to talk to each other, and voice is the key element of great, but where are the patient details? How are we putting all this information into one area where we can start enabling that AI to work around when was the last time they called? Who did they speak to? Can we route them to the same person? Are there specialists that are available now? So AI is only going to grow, but more for the benefit of the any NHS trust, really.
Interesting. Chris, Justin, thank you for joining me today. I found the information you've shared very insightful. I'm sure our listeners will do too. So thank you very much. I'm Mark Blanchard of GovNews, and this has been a podcast talk on de-risking healthcare communications. Goodbye for now.
Bye.
Bye-bye.